Hello friends, as promised, I'm doing this video as an update to the coronavirus situation. I'll be going through a few topics. First, do we have any new information on the virus itself? Not really, but we are realizing it's more and more similar to the SARS virus. So we are now calling it the SARS coronavirus 2. And the disease that it's called is called COVID-19, meaning like coronavirus disease that started in 2019. Second, is there any updates on the mode that the virus is spreading? Again, nothing much, but a small new information. One, we know that it is spreading from infected person to another infected person, but there is also new information that it can still spread from one person who's not having symptoms, like who's not having cough, cold, shortness of breath, to another person as well, because this virus is thought to live in human body anywhere between 2 and 14 days. So the initial 2 or 3 days, if the patient who's initially infected does not have any symptoms, can still spread the virus to another person. So that is kind of scary, because seemingly normal individuals can also harbor the virus and spread it to another person. But again, it spreads when that person coughs or sneezes and you are getting exposed to that respiratory secretion, or he coughs and sneezes on a table or a surface and you go and touch it and keep it in your eyes and nose or your mouth, you can get the virus as well. This is just the updates on the transmission of the virus. Again, there is no further information if it's spreading like through the air or through the water at this time. At this time, we just know that it's spreading through the respiratory secretions. Third, any updates on the symptoms and the disease itself? Mostly 80% of cases are just mild illness. Few people are getting the severe disease, but the severe disease is more common in people who already have like lung problems, heart problems, diabetes and things like that. Majority of people who are normal and healthy before getting the disease are recovering pretty quickly. Finally, any updates on the vaccine and treatments? Yes, there is vaccine. Yes, we are using antiviral drugs. Recently, a university in Chicago has found a specific targeted antiviral which could potentially be used in the disease. But again, no official reports from WHO or CDC, because we just don't have enough data regarding the efficacy of the vaccine or the medications at this time. So we're just continuing the supportive care and using the antiviral medications that we have. But there is even more vigilance because of the spread from seemingly normal individuals who don't look sick. There is a lot more screening going on around the world and a lot more efforts taken to control this virus. One note before I end, whenever there is a death about coronavirus, be it in US or be it in India, it's being like media is making a big thing about it. Definitely the cases are increasing. There is more than 90,000 cases in the world at this time. There are close to 100 cases in US and close to 6 cases in India, with a lot more people who are known or suspected are like suspected to have the disease because they were close contacts with the infected people. But the deaths are being blown up. Again, we don't have information if the persons who died were healthy before getting the virus, or they had other comorbidities like lung, heart problems or diabetes, which kind of got worse and contributed in their deaths along with the virus itself. So until we get more information, let's stay safe, stay protected, avoid travel to crowded areas, avoid travel to infected places where the virus is rampant. If you have to travel in a crowded area, or if you are sick, wear a mask. If you have to cough or sneeze, cough in your elbow or sneeze in your elbow. If you're seeing someone who's infected or meaning who's coughing or sneezing or just looking sick, maintain a distance of at least 3 feet or 1 meter from them, so that their respiratory secretions do not get on you. And if you're going outside, touching like common tables, common surfaces which other infected people might have touched, you can just wipe it with an alcohol-based wipe before using it, especially if you're going and staying in a hotel and things like that, because we don't know how long this virus can live on a surface. It's said anywhere between few hours and even weeks. So until we get more information, practice this simple, safe respiratory hygiene and stay protected. Thank you.